Hello to everyone. I hope you are doing fine. I'm Professor Masood Fuzail. Today we are going to discuss some important information on acne vulgaris or acne rosaceous. What is acne? Acne is a disease of skin which affects many adolescents in the world, and especially elderly people, men, women, boys and girls are all affected. And it is a very embarrassing situation when you have acne on all your face, and it's you cannot go in the public and you feel somehow very guilty or something like that, and you try many different types of remedies to treat that acne, but they are not going away and they are coming back and back. So acne basically is a problem in which our pores in the present in the skins are clogged by dried skin and bacteria, or with oil sebum which is produced by our sebaceous glands present in our skin. So let's look at the physiology, structure and types of acne. First of all, I have taken a piece of skin from our body to understand the detailed structure of the pore of the body. So this is one pore. There are many pores just like this one are present on all over the body, but especially these pores are present especially on the face, forehead, shoulder, upper backside and on the chest, because more sebaceous glands are present in these areas. So if you look at the structure of a pore, so this is the layer of the skin which is, as you can see in the black, these are the cells of the skin, and just inside these skin cell there is a green portion of the diagram. This is a sebaceous gland. Sebaceous glands are specialized glands which are present in our skin which produce sebum. Sebum is a kind of oil which is produced in normal routine to protect our skin from microorganisms like viruses, bacteria and fungi. But there are different types of skin. Some skins are dry because they do not produce enough sebum. Some skins are oily because they produce too much sebum, and some skins produce normal amount of sebum which are known as normal skin. But if the sebaceous gland produce too much sebum or oil, it blocks the pore and cause the infection of bacteria inside this pore. So that is the major cause of the acne. So right on the base of this pore there is a hair follicle from where hair is going to emerge outside the skin, and this pore is clogged by sebum and dried skin cells which are causing a pimple. And pimple is a type of acne which is fluid filled, which is pus filled acne, and which is very embarrassing for a young person. So there are different types of acne on the basis of their physiology, on the basis of their anatomy. So first of all, there are whiteheads. Whiteheads are produced on the surface of skin right where the pores are present, but these whiteheads are closed plug pores. These are closed from the top right over here, and they are plugged with the dried skin and bacteria and some other material. And the second type of the acne is blackhead. Blackheads are usually open from the surface of the skin, and those are also plugged pores, but their contents present in this plugged pore become black due to the oxidizing with the oxygen present in the air. But they can be removed easily, and blackhead can be removed from the skin. The third type of acne are papules. Papules are very small, red, tender, and little bumps on the surface of the skin. The fourth type of acne are pimples. As you can see in this diagram, this is a pimple. It has a mouth right over here from where the pus from the pimple can be moved out when it ruptures, and the whole pore has been blocked by sebum and dried skin along with the bacteria. So pimples are papules, but usually with the pus. Next type is nodules. Nodules are large, they are very solid, and they are very painful lumps present under the skin just inside the pores, and when you touch them you feel pain. The last type of the acne is cystic lesions. Cystic lesions are also very painful. They are pus filled, and also they are known as lumps. They are present under the skin. So these different types of acne can be present in any person depending upon the type of the nature of the person. What are the main causes of these acne? The most familiar causes are following. First of all, excessive oil production, sebum production by sebaceous gland can lead to acne. The second cause is clogged follicle, as we have mentioned earlier. When too much sebum is produced or dried skin collects inside the pore of the hair follicle, then this can cause infection by bacteria or some viruses, then that can cause acne. Bacteria also contribute if your skin is not very clean. So bacteria can penetrate inside the pores and where they can cause infection and cause the acne vulgaris. Inflammation can also, some people have very sensitive skin. So when some inflammatory substance like viruses, like some allergens enter their body or enter their skin, so there is a response which is known as inflammatory response. So due to inflammation, acne can also be produced. So when you have acne, depending upon the type of the acne, then you seek a remedy. So you want to remove that acne as soon as possible. So you try different things. So many types of medications, over the counter and prescription medications are available. So first of all, there are antibiotics. Certain antibiotics are present which are topical as well as oral antibiotics which are used to treat acne, but there is very little effect of antibiotics on acne, because when they go away they can come back very soon, so they become persistent. And also antibiotics can cause antibiotic resistance inside the person, so there should be a very short treatment of antibiotics for acne. Oral contraceptives are specialized medications are used specialized in young female who has hormonal problem, female hormonal problem like estrogen and progesterone. Some gynecologists give them estrogen and progesterone therapy to treat their acne. Androgen is a hormone which are produced in young girls and boys in the age of adolescence. And if these hormones are produced in excess amount, they can cause acne. So there are certain drugs which are known as anti-androgen, like aldactone, can be given to the patient to treat acne, but there are very side effects for this disease, for this kind of treatment. Isotretinoin is also a derivative of vitamin A which can be used to treat acne, but there are a lot of prolonged side effects for this medication. Azelaic acid can also be used in different forms, like in the form of a topical gel. Salicylic acid is also used. Retinoids can be used, and Depson, which is a gel, topical gel, can be applied on the acne. So treat, but these acne are not going away. They are persistent and they come back again. Some people are lucky; they can have a treatment and their acne goes forever. And other therapies, if we look at the other therapies, there is a light therapy. Different types of light waves, light radiation are used to treat acne, but there is a lot of research need to be done on this therapy. Chemical peels are used. Certain chemicals are applied on the surface of the skin to remove excess acne or excess chemicals from the skin to remove acne. Drainage is a special procedure which is used by certain physicians, in which pimples are broken down and all the pus and all the dead material from the skin is removed, which is known as drainage. At the same time, some treatment people use steroid injection, like corticosteroid injection are applied for inflammatory acne to remove the inflammation in the skin to treat the acne. There are also some other therapies which are like some people use tea tree oil, which is a very good to treat acne. And the same way, homeopathic medicine have certain medication which can be used to treat acne. But if the acne is not going away, then we have to look at what is the reason that it is not going away. So I'm going to discuss one cause of this acne, which is known as cystic acne, and basic physiology. So in the basic physiology of cystic acne, let's look at the foreign protein. Foreign protein, especially casein. Casein is a protein which is found in dairy products like milk, like cheese. So this protein, when enters in our body, it acts like an antigen, and this antigen is act like a vaccine and produce antibodies in our body, just like a vaccine. So when we eat foreign protein like casein, it causes to produce antibodies in our system. Usually it does not produce any antibodies because proteins are dietary. We have to take protein. But some people, they are very sensitive. Whenever they take a protein, it becomes antigen and they produces uh, antibodies in the body. Antibodies, what happen, they are the part of the immune system. They activate the immune system of our body and immune response is started. This immune response activate two things. First of all, neutrophils, which are white blood cell, and second is histamine, which is a chemical which is released in the blood to produce inflammation in response to the antibodies or infection. Histamine increases the blood permeability towards skins, and neutrophil after this permeability moves out from the blood vessel into the skin cells where they fight with the infection, but they are trapped right over here. So let's suppose this is a blood vessel. So from blood vessel, white blood cells move into the skin where they are trapped and they become dead, and they play a very important factor in formation of the pus inside these pores, and this will cause a pimple, cystic pimple inside the. So whenever you have a problem of pimples or acne by eating casein or some proteins, then we must avoid that food which is causing your acne. So if the person having acne by eating casein protein through dairy products, he should avoid or she should avoid by consuming dairy products. Then what will happen after a couple of weeks? All the acne has been gone because there is no this physiology as I discussed over here is not working and person is feeling good. But there is also some paleo diets that can be used to treat acne. First of all, we will take low sugar diet, such sugar which use carbohydrates in large amounts. We are not going to take that food, especially low carb food where we are going to take, and we are taking high protein, especially white meat, chicken or fish. So or you can take beans, or you can go to vegetarian diet, and this will take 1 week and your all the acne has been gone. So you are your own doctors. You have to look at the things which are causing your acne. If these are hormone, you should have a hormonal therapy. If this is a bacteria, you should have an antibiotic. If it is due to some food like allergies, due to some casein, some cereal, some other products or some other chemical, then you should avoid that thing so that you can have a clean, bright and healthy skin without acne, and you can go anywhere with the confidence. Thank you so much for watching, and I hope it makes sense, and I'll see you in the next lecture. Until then, bye.